Hello everyone, today we have an amazing and interesting case that you are going to watch if you want to avoid to die of a septic shock because of a tooth infection. Yes, you can die of a septic shock if you don't have a dental infection treated on time. You can have that bacteria in your heart. People with heart attacks, there's a lot of studies where they found the bacteria are in the heart, and you don't want to have a heart attack and the bacteria are in your heart at the same time. How do you avoid that? With brushing, flossing, every single night. Follow the steps I give in several of my episodes on how to brush and floss correctly, and you will never get to this point. This patient came with so much pain. He was very concerned because his gum was swelling and his face was red. He had fever the night before. These are very dangerous, they're deadly abscess on the patient's mouth. So what do you have to do? If you see something like this, by the time you get to the dentist, try to press it yourself. But if you have access to dentist or an endodontist is the preference, then he's gonna have to take care of this infection. How do we do it? When you see this dark area, you're confirming the patient has an infection. Also, we use a marker that in case went to the side, usually goes to the area of the infection, but we knew this was the tooth that the patient was in pain. So what do? We did a root canal in the tooth of this infection. We clean it, we disinfect it, and this is the way you're gonna see your root canal finish. Always be sure it covers all your roots. And after the root canal, you're gonna have a build-up place in the area where we do the root canal. This area needs to have a clean area, and on top of it, you're gonna have a crown, just like in this tooth. That what they do after the root canal, they're gonna do this build-up, and then the dentist is gonna put a beautiful crown in there. Now, once the tooth is better, I saw this patient a week later, and from this inflammation, look how no inflammation at all. I put a temporary material in his crown. After the 2 weeks that he came, he still have the material covering. That this infection that we see here, it disappeared 2 years later. I have a year later, but this is 2 years later. I like to do my root canals, and every year the patient can come to the office with no charges. And right now the patient is being 10 years with more than 10 years, because this is 2 years later. It's like 14 years with a successful root canal. Of course, I asked the patient to have a good prognosis, wear an eye guard because he was grinding his teeth, do flossing, brushing, and everything that I'm repeating all the time. Why? Because what is the option that you have? If this patient has lost a tooth, then he has to go to the painful treatment, which is having an implant. They're gonna put a bone. Of course, it's like from $2,000 to $8,000 just for the implant, and then you have to pay the crown. It's extremely expensive. After the implant, 3 months later, they gotta put an abutment, which is this one, and I have it in another episode, and on top of it is gonna be your crown. Having an implant can substitute the root canal, but it will never be the same because this is not your tooth. Preserving your natural tooth is the best advice I can give you. I hope you like the episode, and you can subscribe to our social media, YouTube, Facebook, Instagram, and TikTok. Thank you.